And so we usually recommend that just getting a quick check by an eye doctor before the age of 12 months is the initial time that we want to see a child. And then anywhere between the ages of 3 and 5, with kindergarten starting younger these days at 4K, we want to make sure that the vision is as good as it can possibly be before a child goes into school, because learning can certainly be affected by vision problems. And so anywhere between that age of 3 and 5, and then before first grade, and I recommend yearly after that. Kids can change so quickly, especially if they're going through a growth spurt. If they grow a lot taller, that's a lot of times when the eyes can change. And so we recommend every year to make sure that we're staying on top of things. So, in kids, unfortunately, or maybe fortunately, they don't necessarily complain about anything. And so they're not going to necessarily tell you that they're having a problem seeing, and especially if it's one eye and not the other eye, which is, of course, why we recommend the routine exams. But looking at your child at home, a couple of things that you can watch for is, do they seem like they're getting close to things to be able to see them? Do they seem like they're walking close to the television? Now, sometimes that's just a habit. Kids like to be in the action, and so they might get really close to a TV just to see what the cartoon is all about. But if they're getting close to things, especially very often, or if you're pointing things out to them on the road, if you're saying, hey, look, there's McDonald's, and they seem to not even be aware that that's there, for instance. If they're holding things real close to their face, or if they're turning their head to one side, like they're trying to literally look more with one than the other, those are important things to watch for. If they are maybe squinting, kids don't always do that, but as they get a little bit older, they may start to do that, maybe squinting to try to see, or if they're complaining about a lot of headaches. Rubbing the eyes a lot is also something that parents don't always necessarily realize might mean that actually they might even need glasses. So perhaps that they're rubbing the eyes or really complaining about how their eyes are feeling. And so in a child, we look at not only do they need glasses, because that's, of course, the first thing we always think is, does somebody need glasses? But we also want to make sure that their eyes are aligned, that they're working well together. The muscles of the eyes work well. We want to make sure that one eye is not necessarily a lot worse off than the other eye, whether it's due to a prescription or due to a turn of the eye or something along those lines. And so it's so important for them to be checked at a young age to make sure we're giving them the best environment for their eyes possible, whether that be glasses, whether that be surgical intervention, whether that be something to do with maybe patching the eye or doing eye exercises, which kind of sounds funny, but there is such a thing as vision therapy that can help really build up the strength of the eye that maybe isn't seeing quite as well, and get the two of them working well together so that the visual pathways can lay down like they need to and set them up for success as an adult.